Hello and welcome. My name is Ellen Treppe, and on behalf of the Office of Alumni Relations at Thomas Jefferson University, I want to thank you all for joining us. With the return of warmer weather and in-person races, now is the perfect time to learn a little more about one of my personal passions, running. We'll have time at the end of the program to address your questions, so feel free to submit those using the Q&A button at the bottom of your screen. Let's get started tonight by welcoming our panelists. Tonight, we are joined by a 75-time marathon runner and Thomas Jefferson University head cross-country and track and field coach, Dave Thomas, Rabia Bauer, coordinator of the Masters of Science in Nutrition and Dietetic Practice program in the College of Health Professions, Dr. Kelly Pagnotta, assistant professor and program director of the Master of Science in Athletic Training program in the College of Rehabilitative Sciences, Trevor Sasek, MS-19, a psychotherapist and founder of Crossover Counseling, Life After Sports, and Megan Yates, BS-14, MS-16, a licensed professional counselor and founder of Crossover Counseling, Life After Sports. Panelists, thank you all for joining us. Coach Thomas, take it away.
Thank you, Kelly, and thanks everybody, alumni, for joining our talk tonight. It's one of my passions also. I've been running for since I was 14 years old. I'm 64 years old now, so I feel for it. But I'm here tonight to talk a little bit about prevention of injuries. So with running, and distance running especially, there are a lot of injuries that happen along the way. And the major thing is that I find as a coach and as a runner is preventing these injuries. So that's the main goal. And what I find is in my coaching, the most important thing is first determining your present fitness level and your goals. So if you're a new runner out there, or if you're an experienced runner, you first have to know, okay, what level am I at? And again, what are my goals? So am I running just to get in shape? Am I getting in shape to lose weight, to increase my aerobic fitness? Or am I training for a specific race? So obviously the training for that is going to be very specific to what your goals are, in running. And the main thing over my years is finding the principles of training. And these can follow any sports, but mainly in running, you want to start low, build slow. That's my major thing that I tell everybody who wants to get into a running program. Start low, build slow. You have to be very patient as a distance runner in your progress, or else you're going to run into some problems down the road, which is going to stop your training. Three big letters, remember, is FIT. FIT. And what that stands for is frequency, intensity, and time or duration. So once you say, okay, I'm a beginner runner, how many times should I run a week? That's your frequency. Well, obviously, you don't want to be starting with 7 days a week. I would suggest, you start with maybe 2 to 3 times a week. Give your body a chance to, test yourself for the running or, run, walk, have a rest day. Don't do anything at all, or maybe cross-train a little bit. So that's the frequency. If you're an experienced runner, you're going to be running up to 14 sessions a week. I mean, when I was in heavy training, not to say I was running 120 miles a week. So obviously, it depends on what your level of what you're looking for and what your level is. Number 2 is intensity. How hard do I run? How hard should I be? With intensity there's 3 major energy systems. 2 of them are aerobic. Aerobic is having enough oxygen to your muscles that you can continue the running. And one energy system uses more anaerobic, which means, that's when your lactic acid is building up and you're running kind of too fast. I would suggest if you're a beginner runner, you should be hanging most of your training down around that aerobic phase, which is like a 60% of your capacity, or, up to maybe 80% of what your capacity. Now, what is that? That's based on your heart rate, your maximum heart rate, so a percentage of that. Or with beginner people, I try to get too scientific with the heart rate. Perceived exertion is a key. So if 1 is very easy, which means you're very, basically walking. 10 is like, you're really breathing heavy. It's hard. You're getting anaerobic. That's a 10. You want to kind of hang around where like a 6, no more than an 8 when you're running, so that your body's being fed oxygen. It can continue to move on that progress. If you do that, that's how you're going to kind of keep training and progressing without running into any type of serious injury down the road from overdoing it. So that's number one is, frequency, intensity. And the last one is time, or duration. How many time, how long should I be running for? I would suggest if you're a beginner runner, hey, I want to get into running to lose weight. I'm just starting to get into it. I always push a run walk program. And I always set a time for beginner, no more than being out there and moving for about 20 minutes, 3 times a week as a good start. And that doesn't mean you're running straight for 20 minutes. That means, running for maybe 2 minutes at that 6 to 8 perceived exertion, and then walking for 2 minutes, let the heart rate kind of come down, and then do intervals back and forth until you reach that 20-minute mark, and then slowly work up. Obviously, if you're training for a race, if you're training for a marathon, well, you're going to have, I'm assuming you're an experienced runner to run 26 miles if you're running a couple of years. Well, there the training is going to be, you're going to have to get out there and you're doing at least an hour run a couple of times a week, and you're running up to 3 hours, once every 2 weeks. So your body's getting used to running that 26 miles, and you're going back and forth. And if you're an experienced runner, you're starting to feed in specific workouts, hill training, intervals on a track, ins and outs, which means pickups along the way, getting very specific. And you're running 7 days a week or more. If you're very experienced, you're running twice a day, if you're really trying to, make a good time and you've been running for 7 or 8 years. But I'm assuming most of the people out there tonight, are in that beginning phase. And I'll answer questions later on, with that. So let's stick more with that. So duration, FIT, frequency, intensity, duration. Preventing injury. Again, focus on building your muscular and your cardiovascular system. So let your body adapt to the punishment of running. I don't believe there's any sport out there that takes as much punishment on your body than the process of running. So it's very adaptability. Your body has to adjust. And like I said, we go back to FIT. Start low, build slow, have some rest days in there, and all those kind of things. Be very specific to what to what your goals are. So number one was the goals, and then be specific to gaining that. I would say, in my experience, it takes about a year to kind of get your body used to adaptability, being used to, getting out there a couple of times a week, for at least 20 to 30 minutes, and steady training without any breakdown of muscle tissue. And you're building up your cardiovascular system. It takes about a year. And then to be a really good distance runner, and you want to really work on the races, get better, I suggest it takes about 5 to 8 years. So like I says, start low, build slow, be very patient with your training, okay? And very specific. We always talk about hard day, easy day, and that kind of focuses in there. Hard day means, if you're a beginner runner, you're going out for a 20-minute walk run. The next day, you're either riding a bike or you're taking completely off, or maybe you're lifting weights, very easy, that kind of thing. And then the next day back is your hard day again. If you're an experienced runner, an easy day might be like an 8-mile easy pace run where your heart rate's at like 60%. Your hard day might be a time on the track where you're running, for an example, 20 quarter-mile repeats, like once around the track hard, one easy, one hard, one easy. So our runners at Jefferson, I have about 40 people in the team. They've been running since high school. And, we have those principles. They're running 7 days a week. And some days you're on the track, some days you're running hills, some days it's very easy. So again, it goes back to who you are, what's your goals, and be very specific to what you can do. That leads us into getting started. Okay, how do I get started? First thing is, besides your goals, is shoes. I would suggest go to a really good running shoe store. Don't go to your typical mass sporting goods place. Take the time out, go to a running store, because shoes nowadays are very specific to you. They're cut to your foot. If you're a pronator, supernator, which means you're turning in or you're turning out too much, there's shoes specific to that. So find a reputable shoe store that's specific to running. Spend $120, and do the right thing. It's the only piece of equipment that we use in running. And I suggest every 400 to 500 miles is when you change your shoes. And your dress, what you wear. It's going to be very specific to what the weather is. So obviously, if you're training in the wintertime, you're going to buy running gear that's going to be, keeping you warm. If you're training right now in the summer months, things that are very light, that are breathable, that dry real quick. Okay, so match what the weather is as far as your dress wear. Now your training session. Every training session should have 3 parts. It should have a warm-up, it should have the actual work phase, and it should have the cool down. As a coach and as runners, you're going to be better off, don't just run and put your shoes on and go out for a run. Spend a good 10 minutes on what I call a dynamic warm-up, which means, you're moving your body parts, all your body parts. You're doing jumping jacks. You're doing toe touches. You're moving your body through different motions for about 8 to 10 minutes, and start with either a walk or start with a very slow jog into your run. So it takes your body that much time to kind of work up, get the blood to the working muscles and work in. You're going to save yourself a lot of trouble and injuries if you can kind of do it the right way. Then you actually do the specific workout, whatever that is. And then always finish your workout with a cool down, which means use that last half mile or mile, either walking or slowly coming back to a jog, getting that heart rate back down to the starting point, and then finish your session before you take a shower. Spend a good 10 or 15 minutes doing what I call static stretching. And you've probably seen that. That is going through a specific motion, like a hurdler stretch, holding the stretch for at least 20 seconds to 30 seconds. And what reason why we push that is when you get done a workout, your muscle fibers tend to bunch up and kind of close in. You kind of want to bring them back to a good starting point. That allows oxygen, nutrition to come into the muscles and the waste products out of the muscles, and helps recover for your next workout or next session the next day. If you could do that long term, you're going to save yourself a lot of downtime with possible injuries down the road. Now let's get up to actual injuries. Very quickly, they fall into 2 things. 80% of your injuries are soft tissue. So they're going to be either muscle, bone, tendon, ligament. And most of those injuries, and we'll talk about a couple of those things, is, they fall on because you started too much too soon. Either you're running too much at one time, duration wise, you're running too many days in a row. You weren't starting, you're starting above your head of what your body was able to adapt to. And your tissue hasn't had enough adaptability time. It's going to get inflamed. It's going to shut down. So you're going to get something like a tendonitis, which falls in like maybe Achilles or the knee, their hip. You're going to get some type of irritation in the muscle or in the tendon itself. Or, heaven forbid, the bone tissue itself will start breaking down, and you either get, what's called a stress reaction, which means a specific part of the bone, whether it's your foot, your shin, your hips, starts getting a small little crack in it. It may start as just a dull, aching pain specific in that area, but what happens over time, it'll develop into something more serious and an actual stress fracture. Now you're talking a downtime of 6 to 8 weeks. Okay. Injuries are very specific. And when you get to that point, you're going to be seeing a professional. So anything where you have a pain going, where you're running and you're running for 5, 10, 15 minutes, and it's getting worse, where it's either hurting your function or it's making you stop, or it's just getting a worse pain, that's a good time just to shut things down, seek a professional, whether it's a physical therapist or your doctor or an athletic trainer, and getting some treatment on it. Treatment for your soft tissue injuries are going to fall in the line of ice, rest, elevation, all those things that, they're going to need to do. What we're trying to do is, with these principles of training, is prevent injury. I've probably trained over 1,500 runners in my time, from every beginner runners to very experienced runners myself. And that's the biggest thing, is try to instill in people is train at your level, work up slowly, and you'll prevent 80% of the running injuries out there. We're not like any sport where, you're going to get knocked over or get tackled or so forth. They're very controllable things. The other kind of injuries are not really injuries, or what I call syndromes. And that falls in the line of like a side stitch. Okay, something to be controlled. So I heard one of the questions out there was, how to prevent a side stitch. And what a side stitch is your diaphragm right below your stomach. A lot of beginner runners, their breathing pattern is off. They're taking shallow breaths and they're not taking them from their stomach, and they're breathing too quick to their running. And what happens is the diaphragm starts going into a spasm, and you'll get a side pain, and you'll have to stop and stop. Biggest thing you can do is just kind of work into it. Most runners I find after the first year running, your body will adjust to it, and and you won't get the stitch anymore. That's mainly what it's from. Is start thinking like breathing from your stomach and from your diaphragm, as opposed to shallow breaths from your chest. Try that out. You can also try massaging your actual, right where it hurts there for about 5 minutes, like any spasm, and that will relax it out. And then a couple other syndromes is, getting like blisters. Blisters are very preventable. Most blisters come from socks. You don't have your socks pulled up tight enough, and then over time you're getting some friction in that crease in the sock, and that's what's causing the blister. I've run races over 100 miles long, 24 hours long, so wore the same pair of socks, never got blisters. So it's not the length of time that you're running; it's basically making sure that they're pulled up tight and there. The biggest thing is what I call jock itch or friction injuries below your armpits, between your legs, and your nipples. If you're a beginner runner, I stress maybe put some Vaseline in those 3 spots, and that'll prevent the injury of the running of the tissue, running together, or your clothing, causing that friction. That's what I would recommend. Muscle cramps. A lot of times, that if it's not some type of injury or something, it could be something nutritional wise, from maybe being too hot, you're not taking enough water in, or from maybe a low potassium, which we'll cover in the nutrition end of this talk. And then the last thing I just want to cover quickly is biggest prevention of injuries I find, especially beginner runners, you're neglecting your running form. Okay, I would stress first is start low, build slow, but have someone watch you either on a treadmill or at a track and watch your running form. You want to have your form where you're standing tall, where your hips are forward, your chest is out, you're looking about 20 yards ahead of you, and your turnover. So when your foot hits the ground, you're landing between your big toe and your second toe, pulling that through, the heels coming back towards your butt, and then you're reaching out again. You probably heard the term overstriding, and that's what most runners do. They tend to reach out too far with their toes and their feet too far out in front of their body weight, and that is actually putting a brake on. You're not hitting you're now hitting, with the heel instead of the midfoot, and that's causing a whole break up your shin, up your hips, and a lot of times injuries are from that because you're just putting a brake on. That stress isn't being released in this thing. So think like you're riding a bicycle, standing tall, hips forward, and landing and pulling that straight through. Number 2, with your stride, foot strikes. Okay, so your foot should be hitting that ground, about 100 to 60 to 180 times a minute. That's about 85, 90 strides a minute. Doesn't matter if you're a 10-minute miler or if you're a 5-minute miler. It should be a good turnover, so you're not just what we call plotters. You're not just boom, 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 going along. I can hear your foot hitting the ground, slapping. It should be very economical, very efficient. I recommend if you have the money or have a person who knows what they're doing, have someone watch you run and make sure your form is good. Before you even get into any type of running program, concentrate on the running form. Most people do not do that. And that, I think, is the major cause of running injuries besides running too much. Okay. That kind of brings me to the end of my talk. I'm just going to move on and on to our next speaker. And if there's any questions, I'll be glad to answer them at the end. Okay, so thanks a lot, Kelly.
Thank you so much, Coach. My name is Rabia Bauer, and I'm going to start the nutrition portion of the talk today. As Alan mentioned, I'm a registered dietitian, and I work for Thomas Jefferson's brand new nutritional sciences department. So I have some nutrition tips for runners today that we're going to go through. I'm really excited to be sharing this information with you, and I'm very open to questions at the end of this presentation, after all the presentations as well. So So we're going to talk about the importance of our macronutrients, carbohydrates, protein, and fat. And we're also going to spend some time talking about meals and snacks for both pre, mid, and post-run. So carbohydrates are the body's preferred source of energy. So when you're running, when you're doing any kind of exercise, you need that energy, you need that fuel to help you get through your run, regardless of how long or short it is. So carbohydrates are something that should be consumed daily. Needs fluctuate day to day, person to person, where you are in your training program. And really you want to focus on getting carbohydrates with fiber. And foods that have fiber are things like whole grains, fruits, and vegetables. Those are all natural sources of fiber. Carbohydrates are also an excellent source of B vitamins. They're added into most carbohydrates in this country, and those are really important for energy metabolism. So again, you do want to eat carbohydrates daily. They are the body's preferred source of energy. Some examples of carbohydrates, if you're looking for whole grains, you would look for 100% whole grain or whole wheat bread, whole wheat pasta, brown rice, whole wheat crackers, and oatmeal is also a whole grain. For your fruits, it's any and all of them. All fruits and vegetables contain fiber. The important thing to remember is that all forms count: fresh, frozen, and canned. So if you can't access fresh fruits for any reason, frozen fruits or canned fruits would also be acceptable, just making sure you're watching out for things like added sugar. One thing to note is that fruit juice often does not have fiber in it, so that wouldn't fall into this category. Finally, your vegetables are also excellent sources of fiber and carbohydrates. So some of our starchy vegetables that have a lot of carbohydrates are potatoes, corn, lentils, beans, peas, and winter squash. So again, all of these carbohydrates have fiber, your whole grains do, and they're the body's preferred source of energy. So you do want to consume them every day to make sure you're fueling your workouts and your runs. Including protein in your diet is really important as well, and it does not have to be animal protein. The benefit of protein is that it builds and repairs tissues. So amino acids are the building blocks of muscle, and those are found in every protein source. Protein can also aid in healing. So you heard a little bit about injuries and how to prevent them, but there's a lot of research out there that foods that are higher in protein can help after an injury, can help that injury resolve more quickly. You do want to focus on lean protein. So sources of lean protein would be things like skinless chicken or turkey, fish, lean beef, low-fat dairy also has protein, and then your plant proteins like beans, legumes, nuts, and seeds. Other sources of protein, if you enjoy a good steak or other types of red meat, are okay occasionally, but sources of lean protein are really what you want to be eating on a day-to-day basis. If you enjoy deli meats, your lean deli meats are things like chicken, turkey, roast beef is actually very lean. So you can include those as part of a well-rounded and healthy diet as well. Finally, you do want to also include fats in your diet, especially healthy fats. So fats are an excellent fuel source during endurance exercise. So if you are running marathons or you're going on really long runs, these can meet your energy needs in smaller volumes. So foods that contain a lot of fat have the highest calorie amount per gram. So if you're in the middle of a run, you might choose a higher fat food source to help fuel that run throughout the whole time. They do have a longer digestion time compared to things like carbohydrates. So my advice is to avoid high fat foods immediately before a race, just because of that increased digestion time. When you're choosing fats to eat, they should really focus on unsaturated fat. So these are the heart healthy fats. So whenever you look at a food label, you can turn it over, look at the fats, and try to find foods that have more unsaturated fat, whether that's monounsaturated or polyunsaturated fat. Those are the types of fats that help your heart. You can also focus on omega-3 fatty acids. They help reduce inflammation. So I don't recommend a supplement. I encourage people to eat these foods naturally, however that works for them. So some examples of omega-3 fatty acids include fatty fish like salmon or mackerel, flax seeds, and walnuts. There's a lot of evidence out there that the American diet is too high in omega-6 fatty acids and not high enough in omega-3 fatty acids. So I do recommend incorporating these foods into your diet as often as you enjoy. So we are going to talk a little bit about meals and snacks as well, again, pre, mid, and post-run. But the key thing is to really keep it simple. Above everything else, eating healthy does not need to be complicated. One thing I do want to stress is depending on where you are in your running program or what your goals are. Good nutrition is going to look different for every single person. I know one of the questions was about finding a dietitian, and I do have some information to share on that at the end. But these are just some basic meal and snack ideas. Again, everybody is different. Your goals are different. So keep that in mind, that all of these may not work for you. So pre-run, we're looking for snacks that provide energy, they help improve endurance, and they prevent muscle breakdown. So again, you're really looking for sources of carbohydrates to provide that energy for your run. So examples of this, again, would be fresh or dried fruit, which also has fiber, a grain-based granola bar, oatmeal or dry cereal, English muffins, toast or bagels, preferably whole grain, so you get some of that fiber, and then pretzels or crackers. Again, these are all carbohydrate-heavy snacks. They're quick and easy to eat, and they provide the energy you need for your run. In terms of timing, most people like to eat at least a half hour before their run. Some people enjoy running on an empty stomach. I encourage a snack before you exercise to make sure you have the fuel your body needs. But I would give yourself minimum 30 minutes, but no more than an hour before you have a pre-run snack. You do need a mid-run snack if you're running for more than an hour. So your body is using the fuel that's already stored in there, and you need to replenish that fuel if you're going to be running for more than an hour. So what this does is it provides the energy to your muscles. And remember that energy is just another word for calories. It can prevent hitting the wall. So again, it's really important to refuel for endurance. And some example snacks of a mid-run snack would be things like peanut butter crackers, because you have both carbohydrates from the crackers and protein from the peanut butter, dried fruit, bagels, gummy candies. These are all excellent sources of carbohydrates, pretzels and banana, honey sticks, or sports drinks. So again, a mid-run snack is suggested when you have a run that's over an hour. And what these do is help replenish the calories, replenish the energy that you've used up, and then give you a little bit more so you can complete your run. Focusing on different carbohydrates, again, is key here, but you can add a little bit of healthy fat or healthy protein if you add something like peanut butter. Last but not least, it's important to fuel after your run as well. So for post-run meals and snacks, there's some ideas here, and these are key for your recovery, right? So after your run, you do want to replenish that energy. If you've torn any muscles, you want to make sure that there's protein in your diet to help heal them. And also it can help curb hunger later on. I know some athletes aren't hungry immediately after they've completed a workout. Sometimes that hunger hits them later, but it's important to refuel and make sure that you're eating well to fuel the rest of your exercise. So some post-workout snack ideas are something like a smoothie with fresh fruit and Greek yogurt. Your Greek yogurt is a source of protein. It's a source of calcium, which is important for your bones. And then your fresh fruit is your carbohydrate. A peanut butter and jelly sandwich on whole grain bread, which is one of my favorite snacks. Kind of classic and brings me back to my childhood. But again, you get the protein and healthy fat from the peanut butter. Jelly just adds a little bit of sweetness, and that whole grain bread is a source of carbohydrates and fiber. I know a lot of people really love sports drinks to help hydrate and replenish. And we're going to talk, I'm not, but someone else is going to talk about hydration a little bit later. But even something like milk or chocolate milk can be an excellent post-workout snack. Milk, again, has that protein, has calcium, has vitamin D. It's all these nutrients that can help refuel your body after a workout. Whole grain crackers and turkey slices make another snack. Again, we're combining carbohydrates and protein from the turkey. And an orange and hard-boiled eggs is the same idea. So your orange is a source of fruit, and a source of carbohydrates, and your hard-boiled eggs are a source of lean protein. If you want a meal, you want something a little bit larger, you can take 2 or 3 of these snacks and combine them together. Or some other ideas would be things like a turkey sandwich with green salad, a burrito bowl with rice, beans, chicken, lettuce, and tomato. So you're getting all those macro and micronutrients mixed together. Or something like a veggie omelet, which will provide you with protein, and then also toast and fresh fruit. As you can see, it's really just combining different foods, those different macronutrients, protein, carbohydrates, and fat in a way that works best for you. All 3 of them are very important for fueling your body and making sure you have the energy and the endurance to get through a run. With that, I just have my contact information. Feel free to reach out if you have questions. My email address is here, as is my office phone number. And with that, I'm going to turn it over to our next speaker.
Great, thank you. That was a fantastic lead-in. And we are going to discuss hydration for runners. All right, so if you can see my screen now, we're going to talk about some hydration issues. And I know that a lot of people are well aware of the hydration benefits and why we should drink water and why we should be hydrated. But there's a few kind of nuances within it that I think are important to discuss first. So as we go through, I want you to remember that hydration, it goes over a continuum, right? So this is not one of those situations where more is better, right? So when we look at this and we look at hydration, there is an optimal range of where you're well and what we call euhydrated, or just, well hydrated. And in that range, you're going to have better workouts. You're going to have quicker recovery after workouts, which is fantastic. But you're also going to have an increased focus and concentration, some reduced anxiety and stress, smoother, more vibrant skin, and more energy. So all things that just keeping well hydrated throughout the day is super important. But this is not one of those things where more is better. There is the ability to become overhydrated. And so when you become overhydrated, what's going to happen in a normal life is you're going to end up standing in line to use the restroom all the time because you're going to have increased urine production. Bad things. When you're dehydrated, you can have the opposite effect, but you still have decreased performance and decreased outcomes. So we want to stay right in that middle line. All of your muscles, including your heart, need water to function. So this is super important to maintain a good hydration status. And hydration helps prevent injuries, as we talked about before. So in addition to training properly, wearing the right shoes, stretching, pre-workout, warm-ups, nutrition, hydration kind of adds right in there to this prevention of injury standpoint. Now, signs that you might be overhydrated, aside from continuously using the restroom, sometimes you might get dizzy, you might have headaches. There may be swelling, which just says that there's an increased amount of fluid in your body, but you'll also have that decreased cognitive function and performance. Unfortunately, it's all kind of similar with that dehydration. So you can be dizzy, you may vomit or have a headache. Sometimes cramping can be caused by dehydration. There's a number of things that it could be caused by. Hydration is one of them. You'll also still have decreased cognitive function and decreased performance. You're also more likely to be susceptible to having a heat illness if you're dehydrated as well, because your body is losing water through sweat because it's hot out, and you're going to become dehydrated, and then you can't cool yourself as well if you don't have as much sweat. So staying on top of that, especially as we get into the summer months, is really important. So really what I want you to get from these two pictures is I don't want you to be on either side, right? I don't want you to think that more is better and I'm just going to chug gallons and gallons of water and I'm going to be fantastic. But I also don't want you to be scared of being overhydrated and not drink water at all. So really it's a balancing act. And how do I know, right? So how many ounces of water should an athlete drink per day? I get that question all the time as an athletic trainer. And unfortunately, I don't have a great answer because one size does not fit all in terms of this. But I'm going to provide you with a couple of different strategies to kind of try out, and you can test to see what you think is best. They're all pretty good. They all work. And they're all just recommendations of things that you can try. So the first one is going by your thirst. We have a thirst mechanism as humans, and it kicks in at about 2 to 3% dehydration. So if you're thirsty, you're already a little bit dehydrated. If you're not exercising and you are thirsty, drink. If you're not thirsty and you still continue to drink just because you're bored or it's something to do, or you think that you might be getting dehydrated, what's going to happen is you're just going to end up using the restroom if you have too much water. Not a big deal, mild inconvenience, particularly if you are far away from a restroom, you're on an airplane, something like that. Otherwise, use your thirst. It's there for a reason. The other way, and this is getting when I ask my patients this, and I worked in the secondary school for a long time, so my student athletes were, teenagers, and they thought it was weird, but going by your urine color. So every time you use the restroom, check out what color your urine is, and it gives you a really good indication of how hydrated you are. If you can stay in these 1, 2, and 3 range, you're pretty good. If your urine starts to fall into these 6, 7, 8 ranges, you're dehydrated. Okay, so urine color is a fantastic measure of your hydration status. The more clear you are, the more hydrated you are. Now, just remember, there are other things that can impact your urine color. So if you're taking multivitamins, sometimes that makes them highlighter yellow. Doesn't mean you're dehydrated. It just means that you have an abundance of vitamins sometimes. But in general, aim for more clear urine, and you're going to be on track for having a pretty good hydration status. As you start to notice that your urine gets darker and darker, you should probably start increasing your water intake or your fluid intake in that. The other way to check your hydration is through measuring your body mass. Even if you are on a new workout program and you're dieting and you're exercising and you're eating healthy and you're on these new fitness routines, your weight shouldn't fluctuate day to day, hour to hour, pre-post workout that much. It's going to become a steady decline. Pre and post workout is going to be a great idea of how much you need to drink during your workout, but throughout the day, like day to day, if you start to notice big jumps or big decreases, you're going to know that maybe you're taking on or not taking in enough water or fluids as it is, because those big jumps are typically coming from fluids within that. So keeping track of your weight changes is an excellent way to do that. When we talk about rehydration and how much should I drink after or during a run, this is where things become a little bit more individualized. And this is where weight changes are really super helpful. So I always like to have my athletes, if they're not sure of how much they should drink and the urine color thing's just not going well for them, or they have some other concerns, is we always just get a general idea of how much they're sweating and how much they're expelling during exercise. So we take a pre-workout weight, we subtract it from the post-workout weight. As long as they're not drinking anything in that, then we know that's exactly what their sweat rate is. But either way, if you take your pre-workout weight minus your post-workout weight and times it by 1.5, it's going to tell you how much fluid you need, because you need about 150% of your body mass loss during exercise to replace in fluids. So let's look at this chart, because that's probably going to be a little bit more straightforward. And unfortunately, all of the recommendations are, kilograms and liters. And here we are in the US, with our pounds and ounces. But let's say you lose about 2 pounds or 1 kilogram of body mass in an exercise period. So I went out for a run and I lost about 2 pounds in my run. Well, that means I need about 1 liter of fluid to replenish. Now, that doesn't mean that you need to sit down and drink an entire liter in one big gulp. Rehydration should occur within about 2 hours. So you have about 2 hours to get that much fluid in, and you can time it and you can take it in continuously. Now, if you drink during, you're going to obviously have less because you don't have as much to replenish. Depending on the length of your exercise program, how long you're going out, what temperature it is, what you have access to, sometimes you don't drink as much during the workout. Sometimes you drink just enough to not be super thirsty, or you didn't bring a water bottle, or they didn't have an aid station at your race, whatever it is. You can kind of use this as a guide, but I do want to make it abundantly clear. These are general recommendations. And if you are experiencing specific health problems or you have really specific concerns, talk to your healthcare provider. I think talking to a registered dietitian, they are fantastic with hydration as well. Talking to your physician, an athletic trainer, someone along that who's knowledgeable and can come up with more specific plans for you are going to be fantastic. And now for the great debate, and I think that this was one of the questions, but what should I be drinking? Do I need a sports drink or water? And if I need a sports drink, even what's best? Well, when we think of a sports drink, most people think of sports drink in replacing their electrolytes. And so let's talk about what electrolytes are really quickly. So electrolytes include our sodium, our chloride, our potassium, magnesium, and calcium. And these are all things that are lost in our sweat when we exercise. But we don't always have to replenish them through a drink or through liquid. We can replenish them through most of the time through our food intakes. So table salt, pickles, tomatoes, potatoes, bananas, pumpkin seeds, spinach, milk, collard greens, all great things that aid in our recovery. So if you're losing electrolytes, which we all do when we sweat, making sure that they get replenished afterwards, especially as Rabia went through with the nutrition, right? You can get a lot of these back throughout. The other thing to remember is that you don't actually need to replace them during an exercise if it's less than an hour. Now, if we're exercising more than an hour, that's when we want to really start to consider adding these things in. It goes the same way as our fuel and our nutrition. So that 1 hour window, that 1 hour time frame of should I have water, should I have a sports drink, should I have a mix of both, is a great reference of where to start. Now, there's positives and negatives of both sports drinks and water that I want to highlight here. I don't think that one is better than the other, and it's not a one size fit all again, unfortunately. Now, sports drinks have light flavoring that encourage people to drink more so they fully rehydrate. It's great. People like the taste of them a lot of times, so they're more likely to drink. That's awesome. If you're someone who prefers that taste, that the flavoring within it, stick to it. Fantastic. If you prefer water, drink water, and that's fine. Just make sure that you get your electrolytes and your carbohydrates throughout your run from other sources. The lack of flavor can sometimes keep people from fully rehydrating just because there's no incentive and it doesn't taste yummy. I worked with teenagers a lot. The only way I could get them to drink was by giving them sports drinks. It was just what it was. Sports drinks do contain carbohydrates, meaning they have that sugar that's going to help give you the energy during your exercise or during your workout. Water does not have any sugar, it does not have any energy. It's not going to provide that. So as long as you're getting that from other areas, you're fine. But it's, again, what you have access to and what you prefer. Sports drinks do contain a small amount of sodium. Water does not. So do you get some electrolytes through your sports drinks? Absolutely. Are you better getting some electrolytes post-workout from a recovery in whole foods and other things like that? Absolutely. But again, if you prefer the taste and that's what's going to help you rehydrate, then by all means, stick with a sports drink. But remember, they're not needed during your activity unless it's longer than an hour. Okay, so that hour window is a fantastic kind of bridge to where you should go. As far as which one is better, Powerade, Gatorade, Pedialyte, anything like that, they're all about the same. They all have a good general range of 1% carbohydrate, the same amount of sugar, electrolytes. It's really about what you prefer the taste to be. And if you are training for a specific race, so you're training for Broad Street Runner, you're training for the Philadelphia Marathon, one of my biggest recommendations is to look on the website and see what they offered at the aid stations. Most of the time, they're going to be explicit that they offer, or they're sponsored by Powerade, or they offer Gatorade at the aid stations. Sometimes they even tell you the flavor. And just so that you get used to it, or it doesn't upset your stomach, my recommendation is to figure out what that is and then start practicing with that from a training, or come up with your other plan of carrying things with you. Because the last thing you want on race day is to have either that swishy belly or you don't like the flavor and then everything goes chaos. So just kind of keep that in mind as you're going. And I'm just going to add this in as the end. As we approach these warmer months, don't forget to hydrate and hydrate throughout the day. So just because you think, well, I'm going to go out on an hour run, I'm going to chug a gallon of water, all that's going to make you do is have to use the bathroom during your run. So spreading out and making sure that you're hydrated throughout the day is kind of the biggest key and the biggest component for this. And I'm now going to stop sharing and I'm going to turn it over. But again, I'd be glad to answer any questions at the very end of the presentation. So thank you very much.
Awesome. Hi, everyone. My name is Megan Yates, and I'm joined with Trevor Sasek. We're going to talk about the mental side as we wrap up this kind of training and talk, the mental side of engaging in a running training or just performance. So as we get into our talk, we're going to determine a little bit about our why or your why, as well as those common obstacles that a lot of people experience when they're working towards a goal or they're choosing to commit to something new, as well as how to work with those obstacles. And so first, with determining your why, when we start something new that is, like a training for a marathon or any type of running or a new commitment, but it's physically demanding, your motivation and your mindset are going to change as you are feeling physically fatigued or as you continue to kind of get into your training experience. And so what a lot of people don't recognize sometimes initially is that if we don't kind of pay attention to any discomfort that we might feel, fatigue that we'll feel, and our own self-talk that we'll give ourselves as we start to feel uncomfortable or just sore after beginning this training, these can be really big barriers to continuing your new commitment. And so determining your why can really be used as an anchor for mentally withstanding that physical toll that's taken on your body. And as you can see here, we have controlled motivation and autonomous motivation. And so as you kind of think about this new commitment or beginning training for a marathon or just beginning running, it's a good indicator to start with, what is your reasoning? What's the self-determination? And so controlled motivation is when somebody feels kind of coerced or pressured into doing something. And when anybody feels this type of controlled motivation, we actually often feel a sense of tension and anxiety with this commitment. And this can be either self-created or it can be created by someone else. And what research shows is that this type of motivation is shown to have negative consequences on not only your performance, but how you feel in regards to your overall well-being and continuing the commitment. Also, when people feel that they're controlled in their reasoning for doing something, they'll start to take shortcuts, which obviously, as we can kind of think about when we're trying to train for really any activity, but especially running, shortcuts, as all of the other speakers have said, really isn't the end game here. So that kind of moves us into autonomous motivation. And what this type of motivation is it's when somebody has a full willingness and they feel that they're fully choosing to commit to this new activity, like training for a marathon or just beginning running. So you're doing it out of interest and enjoyment. It's aligning with maybe a value that you have or something that you want to achieve. But it's not a commitment that you feel you're being pressured into or coerced into by anyone or even yourself. You're just kind of committing to it because you're really interested in doing it. And what research shows about autonomous motivation is that people who feel motivated in this way actually, in general, feel a lot more creative. They're able to problem solve better. So when you think about the obstacles that come up with training, you'll probably perform better. And you'll have this overall kind of just feeling of positive emotional and physical reactions when you're experiencing this. The three words underneath, we talked about autonomy, but competence and relatedness are also really important when it comes to continuing and sticking to a goal that you have. And what we kind of mean by competence is If you don't feel like you understand what you're doing and you don't feel educated in a new activity that you're committing to, you're likely not going to stay persistent through. If you start to feel like you're not good enough or you don't understand enough. And we're going to talk more about that in the next slide. But I think those of you who are here and you are beginning runners, this is what competence is talking about. This is you're motivated to be here and to learn a little bit more. And that is going to help determine your why and continue that motivation when you feel roadblocks do come up. The last part here for motivation is that relatedness piece. When we tend to commit to things in isolation, they can be really difficult to stick to. So when we have maybe a trainer or some type of professional that we're working with, or a like running partner that you choose to be with, or maybe a group of runners, this is also really going to help with your why. It will help keep you committed. And it's just part of that autonomous motivation that's kind of a 3-package deal. So with this slide, it's really important, obviously, to have, choice in the matter, a self-initiation, and this personal perspective and rationale for your commitment. And so taking time to think about your motivation and the why behind running can be a huge part of those mental blocks that a lot of people experience when they start something new. And so I'm going to let Trevor kind of take over. But one thing I want to mention is that if any of you are interested in kind of helping identify your why or determining that why, if you feel like you don't have it quite pieced together yet, we do have a questionnaire that is called I believe it's Motivation of Marathoner Scale. And that can really piece apart your why and kind of help you stay committed as we talk about these obstacles in the next slide.
Thanks, Megan. So after getting like a better understanding of what your why is for choosing this goal, you can get started with where you are right now and what might be sticking points that you've had in the past. And you think of some of those goals that you might have set for yourself, some of those New Year's Eve goals that might have fell off maybe at March. And then you think, what has come up to slow me down in this and stop me in the progress towards achieving those? This is kind of where your personal psychology comes in. And you can start to take an inventory to gain a better understanding of what hurdles come up internally when you are trying to accomplish something like that requires effort and consistency. So some examples of those internal roadblocks might be, the fear of failure, really wanting to, really worrying about what people are going to think about you, doubting your ability to handle the difficult accomplishments for your goals, procrastination, like spending too much time on Instagram, Facebook, social media, online shopping, or like television. So whenever you have like the planned out activities and you're finding yourself doing that too much, those are times that you can be aware of those things might be potential roadblocks for you. Other examples include having things that take more priority than the running or your goals, like being too busy, feeling like you deserve a break, overanalyzing, perfectionism, or injuries. These all may have a purpose or they might be out of control, but an honest evaluation of if these common parts of yourself can help change that pattern and change your reactions to these setbacks. So as we move on, we'll learn how to work with these obstacles just a little bit. Going to the next slide. Perfect. And then, so having an understanding of these parts like we were talking about that come up when you're mentally and physically kind of depleted from like this long process of trying to get into running is a great place to start to develop a mental plan. So having this mental plan helps address these roadblocks and the discomfort from keeping the progress and getting back into making progress. Say you have a lapse in your routine or a lapse in your plan of getting to where you want to go. So after you found these personal self-talk like obstacles that fit your internal world, and then you can just say, so once you start to try to fight these, people usually try to push them away, but that takes a ton of energy, and fight them and push them. And then what we usually say to individuals is recognize those thoughts, get some separation from the thought, don't let it overwhelm you, and then negotiate with it using what your why is. So you'll get more of an understanding of what the why is if you take that quiz. And what you're reasoning to do it. So once you start to negotiate how you can maneuver back into the reason you started this whole process, and that can start increasing that internal autonomous motivation. Another technique we usually suggest is to create consistent behaviors through habit stacking. So what that is once you've identified the things, like Coach Thomas was talking about, the things that you can do to get into that physical shape, you can start stacking those with other habits that you already have. So for example, if you wanted to run in the morning, and you can remind yourself of your why and then talk about right after it on like a Post-it, have it on the mirror while you're brushing your teeth, and then talk about the 10-minute warm-up that he was saying. So that you can be creative with this. This isn't like a end-all be-all. And this is kind of, for each person, it works with what your why is. So understanding that nobody is perfect, and that with life coming up, feeling the need to be perfect is quite common with this. So the consistency and perfection are definitely two different things. You might tell yourself, I need to follow this plan perfectly. I need to run every single day. My meal prep needs to be every single meal. I need to drink 128 ounces of water a day. But, you know, like Coach Thomas said and gave great advice, you start low, go slow. So return it back to your process. And then following after those lapses in routine, you can still result in accomplishing your goal. And it's not a complete failure. So the last point there is to aim for consistency with the plan. And, you know, going with that, reminding yourself of your why and recognizing the self-talk that comes up and might be keeping you from reaching those personal goals while doing the autonomy, having the competence from some of the things that you've gained here, and the relatedness and finding that connection in some other groups is some of the things that we would suggest to get going with your goals with running. Yeah, thanks. Now I will pass it back to Ellen, I believe.
Wonderful. Thank you so much to all of our panelists. That was so informative, and I know that I was taking notes throughout the whole thing. So if now we'll take some time for questions. I know we're a little bit after 8, but you know, feel free to stay with us. We'll take some questions. And so if all of our panelists, if you wouldn't mind, please turning on your camera. There we go. And Megan, I promise your view is not that bad.
I felt a little embarrassed, so I had to jump off.
Yeah, no, it's totally fine. Don't worry about it. All right, so I'm going to kick us off with some of the questions that came in earlier. And to all of our panelists, to all of our participants, please feel free to type your questions in the Q&A box. But I am going to, I think this might be a combo question for Coach Thomas and also probably Kelly as an athletic trainer. But we had several questions come in about what sort of strength training should you be doing as you're building your running practice?
Want me to take that, Kelly, or?
Yeah, take it away. I'll add if there's anything else I think is important.
I mean, we push, what I stress is the word balance. You know, you want to, any runner or any athletes have a good mixture between flexibility and strength. And I found with distance running, just a very basic strength program, which means you could go to a gym and very, you know, as long as you're getting the antagonist, like the muscles in the front of your leg and the muscles in the back of your leg, you're getting your stomach, you're getting your back. So everything you're getting up front, you know, as a flexor, you're getting an extensor. So making sure you're not, you know, getting a program that you're just doing too much chest and not enough back, you know, or too much thigh. So I find a good basic 12 to 13 exercises, hitting all the major muscle groups, front and back, should take you about, if you're a distance runner, I tell our runners, don't be a gym rat. You know, we're not here to train bodybuilders. We're not bodybuilders. We're trying to increase performance and prevent injury. So, you know, you should be in and out of that gym in about 30 minutes, 2 to 3 times a week, on just basic lifting things. And if you want, you know, there's always good balance. You don't want to just keep doing the same thing month after month after month. You know, start basic, start low. We tell our athletes, you know, a distance runner, like 10 to 15 repetitions, 2 to 3 sets at the most, you know, and then obviously working your core, you know, getting that strong too with your stomach and your back. So like I said, you don't have to be in there 2 or 3 hours, half an hour, a couple of times a week, very basic.
Absolutely. We're not trying to isolate every specific lower extremity and upper extremity muscle. We're not doing this for fitness and physique competitions. We're doing it for function. So some of those bigger group muscles and exercises, as long as you're working them appropriately, is really great. And the other really important thing from a preventative standpoint is watch your form. If your form falls apart with weight, then body weight exercises is where we start. So just general squats and lunges, types of activities. Planks are fantastic from a core exercise standpoint. They don't have to be anything super complex, and you don't need to have any, huge, fancy gym membership to do all of these things. And then you can slowly start adding weight. But if your form falls apart with the weight, then you're not ready for it. And you're just doing yourself more damage. So being really cognizant of that. And if after 9 repetitions, your form falls apart, then you're done at 9. You don't need to push to 12. Because again, we need to keep good form, especially as we begin. So all of that is great advice on where to start.
Great. So my next question is for Rabia. And actually, I found your 1 hour frame, and Kelly as well, that one, I had never heard that before about if you're exercising for longer than an hour. So, so hypothetically, let's say I know that I'm going to do a 7-mile run. So I know that I'm going to be out there for at least an hour and 10 minutes. What is sort of the ideal timing for that snack or for that water? Is it like when I have 30 minutes left of my run? Is there some kind of guidepost as to when that should happen?
Well, Kelly, I'll let you do the hydration part first.
For me, it depends on the weather, and it depends on how much I'm sweating, what my sweat rate is, how I feel. If I'm really thirsty 15 minutes into my run, then I'm not going to withhold my water because I'm like, oh, I didn't hit my 30-minute time frame, right? But if I haven't had anything in 30 to 45 minutes, I'm going to try and have some small amounts. Don't try and chug because it's there and I hit that 45 minutes, because then you just end up with that swishy belly. So typically every 15 to 20 minutes, I try and take in a little bit. But if I notice that at a half hour, I really haven't done anything, then that's really where I get concerned and try and take in at least some water. But every 15 to 20 minutes in small increments tend to prevent that upset stomach, sometimes even the side stitches, because now I'm trying to exercise and breathe and swallow and digest, and it gets all confusing. So I think 15 to 20 minutes from a hydration kind of helps in that standpoint.
And I would absolutely agree. So many factors affect how thirsty you are if it's hot out. So, if you're feeling thirsty at any point during that 1 hour run, definitely drink and make sure you are. In terms of eating, so that hour time frame is kind of a loose guideline in terms of if you're going to do endurance exercise longer than that, you really need to refuel. So at an hour and 10 minutes, I might even just wait until right afterwards to have that snack, unless during the exercise you're feeling like you're hitting that wall, like your muscles feel weak. That's a very clear sign that you've used up the glycogen stores in your muscle and you need to start replacing that. So, anything over an hour, go ahead. If you can make it that extra 10 minutes and just do it afterwards, that's fine. But again, you want to avoid feeling like that your muscles are very weak or hitting that wall and that you're not able to go on.
That's where kind of that practice comes into if you're going to be at a race. So, I know that I start to feel like I hit that in some conditions around 45 minutes. So I try and time it that at about 40 minutes, I get it. Or I've looked ahead and I know that there's an aid station at mile 4 that offers a fuel. So I try and time myself. Do I need to bring it? How can it work? Where am I going to be? And just kind of planning. So, but again, everything is individualized. So like Rabia said, if you start to feel like you need fuel, add it. There's no harm. So it's a loose estimate.
Great. So I think for our last question, I'm going to make it a little personal to me. And I'm going to direct it to Trevor and Meg. why not plan a program if I can't ask my own questions, right? So I am trying so hard to make myself a morning runner. And, sometimes, when I hit the snooze button and that why is just not coming up for me, what are some mental games that I can play with myself, or some ways that I can sort of get myself up and get out there for that run way early in the morning?
Trev, you want to take this one?
Yeah, sure. Because that one is, so I know that there's one thing that a lot of people have told me works well for them. It's what Mel Robbins has done. So she does a 5, 4, 3, 2, 1, almost like a rocket ship countdown. And that's shifting your brain from that emotional state of seeking safety and staying in the bed and being where it's comfortable into that cognitive part where you're able to go back. And then you can shift over into, this is my why. I'm doing this because it could be numerous different things. For instance, a lot of long-term runners, their why is to be personally the best and do personal accomplishments, be personal goals. But sometimes starting off, it's more of, I want my physique to change. I want to lose weight. I want to, be socially interactive. So some of those things, that's how you can shift it into, I'm in that comfort state, into why am I going to put myself into this cold weather or outside this warm bed and go out and start running and kind of put myself through this discomfort. So yeah, kind of using that and falling back on your why. But yeah, I have had a lot of people say that the 5, 4, 3, 2, 1, almost like a countdown to jump out of bed, instead of hitting the snooze button, having the snooze button away from the bed.
That's a great tip. Meg, did you have something to add?
I guess
to that?
The only thing I can add, is a lot of times when we hit a moment like not wanting to get out of bed, we're actually thinking from what's called the emotional part of the brain. And when we let our emotional brain take over, what actually happens is our rationale, our logical thinking will actually disconnect for a period of time. So when we are only in our emotional brain, we actually lose the ability to rationally think through and find that motivation. So like Trevor said, if you're able to, and this is where I would also agree that 5, 4, 3, 2, 1, if you're able to do that, you're not letting your emotional brain overtake you. And so what's happening then is your logical reasoning can stay connected. And once you have that back on, you can kind of think through the rest of your day. So it's about finding that balance between letting your emotions kind of take over and give you excuses, if that makes sense.
That's great advice, and I'm going to try it tomorrow morning, and I'll let you know how it goes. Well, to all of our speakers, thank you so much for joining us tonight. I know I learned a tremendous amount. To all of our participants, thank you so much for joining us. And we hope that you'll join us for another event with Alumni Relations very soon, all of which are on our website. And we'll be coming to some of you in person later this summer. But with that, we will close. And thank you again to our speakers. And thank you all, and have a wonderful night.
Thank you.
Thank you.
Thanks, everyone.